walking down billions of streets of a major city, passing by individuals hunching in doorways, seeking shelter under the makeshift tents, or sleeping on the park benches. This is the harsh reality of homelessness, a pressing issue that demands our attention. Hello, my name is Kendall Sampson. Let's explore why homelessness should matter to everyone. The homeless problem in significant cities require immediate action and compressed from the social issues of homelessness to everyone because it reflects the health of our community. It affects those experiencing its drag and impact public health, safety, and overall the well-being of our cities. To understand the magnitude of issues, let us look at some examples of homelessness in major cities across the United States. For example, you could be walking down the street of Los Angeles, passed by individuals hunching in doorways seeking shelter under makeshift tents or sleeping on park benches. Estimated homeless population of over 41,000 individuals as of 2024. Casilla 2024. Despite various infrastructure, homelessness remain a specific challenge. We see similar struggles with homelessness from Los Angeles to New York City to New York, with one of the highest rates of homelessness in the United States. Atkins 2024. Struggling due to its large population and high cost of living. Another major city that is plagued with homelessness is San Francisco. Amidst its tech boom and skyrocketing housing costs, it has a city navigation center model, providing temporary shelters and individual case managers, maintenance to individuals express homelessness, helping them transport into permanent housing. Most 2023, San Francisco has seen a 25% decrease in chaos homelessness over the past 2 years, according to the latest data from the Department of Homelessness and Supporting Housing. At least Seattle has level-aging community partnership to address homelessness effectively. For instance, the city partnership with local nonprofit organizations has developed supportive housing units and wraparound services for individuals experiencing chaos homelessness. McCain 2023. According to the latest reports from Seattle Homeless Service Department, this collaboration effectively has led to 30% reduction in overall homelessness in Seattle over the past 3 years. These examples highlight the challenges of homelessness, from affordability housing to economic dispersity and population density. However, they also showcase the success of housing first individuals, supporting services, and community partnerships in combating homelessness by providing housing, stability, and providing infrastructure support systems. Cities like San Francisco and Seattle have successfully decreased homelessness ratings and improving residents' well-being. However, significant challenges remain, such as the lack of affordable housing options and influctuation supporting systems from homeless individuals, including mental health concerns, staggering abusive treatments, and access to health care. The scarcity of affordable housing is a central issue combating homelessness across major cities. Skyrocketing rents and struggle wages have made it increasingly difficult for low-income individual families to secure stable housing. This challenge, communities must provide development of affordable housing units through interest from developer zoning reforming to allow increased density and infrastructure in population and public housing individuals. Additionally, expanding rent assisting projects and implementing rent control measurements and help mitigate the burden of housing costs on a vulnerable population. Efficient support system further emphasize the scale of homelessness, particularly for individuals grappling with mental health issues, abuse, discoordination, and chaos health concerns. Compressing situations must involve investment in support system control line to delivering needs for homelessness individuals, including access to mental health counseling and sustained abuse treatment and medicine care. Cooperation with local healthcare providers and social service agents is crucial to ensure and collaborate to care for homeless populations by addressing healthcare services into homeless outreach projects and estimating multiple population terms to address complex needs. Communities can provide more effective services and pathways to sustain for individuals experiencing homelessness. Additionally, not in my background, Attitude Homes, homeless shelter, and supporting housing development must acknowledge and address. We need to look beyond what we see on the streets to understand why homelessness happens. Economy decline, where some people earn much less than others, make it hard for families to find and keep a home. With the skyrocketing cost of living in major cities, this economy disparity pushes many into homelessness. Mental health problems, safety abuse play a significant role in homelessness. When people don't have enough support for their mental health issues, they're more likely to become homeless. Staffing abuse can make it harder for people to keep a stable place to live. Understanding these reasons help us see how complex the problem is and why we need a complete solution. Just fixing what we see on the surface of homelessness is like treating the symptom of sickness without fixing what makes us sick. That's why we need solutions that deal with economy ecosystem, giving people better access to affordable housing and other strong support for mental health and substance abuse. Overcoming these challenging community must invest in support systems, collaborate with local healthcare providers and social services economy, and educate the public about the importance of homeless shelters and housing developments. Policymakers must also provide funding for evidence-based projects with proper track records of successful to maximum available resources. Limited funding and resources combat pose significant barriers to combat homelessness, restricting the development of necessary services, offering housing and support projects. To address these funding challenges, public makers must take permanent measures to ensure available resources at all levels of government. Be actively through increasing funding accordingly and forecasting structured partnerships with Philippines organizations and businesses that share community to address homelessness. It's important to provide funding for evidence-based projects with proper track recording of success. Public makers can maximize the impact of available funding by directing resources toward individuals that have effectively reduced homelessness and improve outcomes. Individuals. Despite the ongoing challenge of homelessness, there is hope. Drawing inspiration from successful impactful cities like San Francisco and Seattle, we can gain valuable lessons that inspire hope and moderate action. By joining forces, we can impact and improve struggle that address the root cause of for those affected. Together, we can build a world where everyone has a place to call home and no one is left behind. We can work towards ending homelessness and furthering healthier and more resistant community for all. Thank you for listening.